What if I told you that one of the most powerful healing substances on the planet has been sitting in a bottle on a store shelf, ignored, underestimated, and misunderstood, while pharmaceutical companies have spent billions trying to replicate what it does naturally? What if I told you that for seniors specifically, rubbing just a small amount of this oil on your skin every single night before bed could do something that most medications cannot? Not just mask the pain, not just reduce inflammation temporarily, but actually signal your body's own stem cells to wake up, regenerate tissue, and in some laboratory studies, trigger the natural death of cancerous cells. I know that sounds almost too extraordinary to be true. I thought the same thing the first time I came across this research, but I've spent over 3 decades in medicine, and the data on this is real. It is peer-reviewed, and it is something every senior in this country deserves to know about. My name is Dr. Willem Lee, and welcome back to the channel. If you're watching this for the first time, this is a place where we cut through the noise and talk about what the science actually says, not what the pharmaceutical marketing budgets want you to believe. Today, we are going deep into a topic that I believe is one of the most underreported stories in senior health: the profound multidimensional healing effects of a specific oil applied topically to aging skin, and why the nighttime hours are absolutely critical to making this work. So stay with me all the way to the end, because I'm going to explain the exact mechanism by which this works in the body, which specific oil I'm talking about, and why it's unique, what the clinical research actually shows, and how to use it correctly so you get the maximum benefit. Let's get into it. First, let's talk about what happens to the skin as we age, because most people don't realize just how dramatically the skin changes after 60 and why those changes have consequences that go far beyond appearance. Your skin is not just a protective shell. It is the largest organ in your body, and it is a living dynamic interface between your internal biology and the outside world. It is filled with receptors, nerve endings, immune cells, lymphatic channels, and something called transdermal pathways, microscopic channels through which certain molecules can actually pass directly into the bloodstream and reach internal organs. Now, here is what aging does to all of that. After the age of 60, the skin's production of collagen drops by roughly 1 to 2% every single year. The dermal layer, the deeper layer of your skin, begins to thin. The mitochondria inside skin cells, which are the energy-producing engines of every cell, become less efficient and start producing something called reactive oxygen species, or free radicals, at a higher rate than the body can neutralize. The result is what scientists call oxidative stress. And it is not just cosmetic. Chronic oxidative stress in skin tissue is now directly linked to systemic inflammation, which is the root driver of nearly every age-related disease: cardiovascular disease, arthritis, neurodegeneration, and yes, cancer. But here's the part that is truly fascinating and that most doctors never explain to their patients. Your skin contains something called epidermal stem cells. These are primitive, undifferentiated cells that have the extraordinary ability to regenerate damaged tissue. In youth, these stem cells are active and responsive. In aging skin, they enter a state of dormancy. They're not dead. They are sleeping. And the question that researchers have been asking for decades is this: can we wake them up without dangerous drugs, without invasive procedures, without the kinds of side effects that often make the treatment worse than the disease? And increasingly, the answer coming out of the literature is yes. And certain naturally derived oils applied transdermally appear to be among the most promising vehicles for doing exactly that. Now let's talk about the specific oil I'm referring to, because this is where the science gets genuinely remarkable. The oil is black seed oil derived from the plant Nigella sativa. Now, before you dismiss this because you've heard about it before, I want you to understand something. There is a world of difference between the popular wellness conversation about black seed oil and what the actual peer-reviewed clinical literature says about it. As of 2024, there are over 2,000 published scientific studies on Nigella sativa and its primary active compound, thioquinone 2000. That is an extraordinary body of evidence for a naturally occurring substance. Thioquinone, let's call it TQ for simplicity, is a powerful bioactive compound that works through multiple mechanisms simultaneously. And this is critical because most pharmaceuticals work through a single pathway. TQ works through at least 5 distinct biological pathways that are directly relevant to aging skin and the systemic health of seniors. Let me walk you through them, and I promise I will keep this in plain language. The first mechanism is anti-inflammatory action at the cellular level. TQ has been shown in multiple studies to inhibit an enzyme called cyclooxygenase 2, or COX2, the same enzyme targeted by pharmaceutical anti-inflammatory drugs like ibuprofen and naproxen. But unlike those drugs which are hard on the stomach lining, the liver and the kidneys, TQ achieves this inhibition without those toxic side effects. A study published in the Journal of Ethnopharmacology found that topical application of Nigella sativa oil reduced markers of skin inflammation significantly in human subjects, not in mice and humans, within 6 weeks of regular nightly application. The second mechanism is where things get even more interesting: antioxidant activity. TQ is what scientists call a direct free radical scavenger. When applied to the skin, it penetrates into the dermal layer and begins neutralizing the reactive oxygen species that are literally degrading your cellular machinery. Researchers at King Abdulaziz University published a study demonstrating that thymoquinone activates the NRF2 pathway, which is essentially the master switch for your body's own antioxidant defense system. When NRF2 is activated in skin cells, the production of endogenous antioxidants like glutathione increases dramatically. You are not just adding antioxidants from the outside. You are turning on your body's own antioxidant factory from the inside. The third mechanism involves stem cell activation. And I want to spend a little more time here because this is perhaps the most extraordinary finding in the recent literature. A study published in the journal Stem Cell Research and Therapy investigated the effect of thymoquinone on human epidermal stem cells. What they found was that TQ appears to upregulate specific signaling proteins, particularly those in the W and T-beta pathway that are responsible for triggering stem cell proliferation and differentiation. In plain language, TQ wakes up dormant stem cells in the skin and signals them to start dividing and repairing damaged tissue. For seniors dealing with slow wound healing, thinning skin, and chronic dermal degradation, this is not a minor finding. This is potentially transformative. The fourth mechanism is antimicrobial and immune modulating. As we age, the skin's microbiome, the community of beneficial bacteria that live on the skin surface, becomes disrupted. This disruption is linked to conditions like eczema, psoriasis, rosacea, and increased vulnerability to skin infections. TQ has demonstrated broad-spectrum antimicrobial activity in laboratory settings. And more importantly, it appears to help restore balance to the skin microbiome rather than simply killing bacteria indiscriminately the way antibiotics do. This distinction matters enormously because a healthy skin microbiome is one of the frontline defenses of your immune system. And the fifth mechanism, the one I know many of you are most curious about, is the anti-cancer activity. I want to be very precise here because precision matters in medicine. I am not saying that rubbing black seed oil on your skin will cure cancer. What I am telling you is what the peer-reviewed scientific literature actually shows. Multiple in vitro studies, that means studies done in laboratory conditions on human cancer cells, have demonstrated that thioquinone induces what is called apoptosis in cancer cells. Apoptosis is programmed cell death. It is the natural process by which the body eliminates damaged or abnormal cells. Cancer cells have evolved to evade apoptosis. They essentially become immortal and keep dividing uncontrollably. TQ appears to overcome this evasion by targeting specific proteins, including BCL2 and P53, that regulate the apoptotic pathway. A meta-analysis published in the journal Phytotherapy Research reviewed 31 studies on TQ's anti-cancer activity and concluded that it demonstrated consistent pro-apoptotic effects across multiple cancer cell lines, including breast, colon, liver, and skin cancer cells. Now, does this mean that transdermal absorption of black seed oil delivers enough TQ systemically to have this effect throughout the body? That question is still being investigated. What we do know is that the skin itself contains cells that can become malignant. We call that skin cancer. And that topical application of an agent that promotes healthy apoptosis in abnormal cells is not a trivial thing. The data is early in some respects, but it is consistent and it is pointing in a clear direction. Now let me tell you why nighttime application is specifically important, because this is not arbitrary. During sleep, the body enters a phase of repair and regeneration. Growth hormone secretion peaks in the early hours of sleep. Cortisol, the stress hormone that suppresses immune function and inflammatory response, drops to its lowest levels of the day. Cellular repair processes, including DNA repair within skin cells, are most active between approximately 10 at night and 2 in the morning. The skin itself becomes more permeable during sleep. What dermatologists call nocturnal transdermal conductance increases. In practical terms, this means that substances applied to the skin at night penetrate more deeply and are more bioavailable than the same substances applied during the day. You are not just applying the oil at a convenient time. You are timing the application to align with your body's natural healing cycle. This is chronobiology, the science of timing biological interventions, and it matters far more than most people realize. So, let me give you the practical guidance you need to actually use this. When selecting a black seed oil, quality is everything. You want an oil that is cold pressed and unrefined. Heat processing destroys TQ. Chemical solvent extraction introduces contaminants. Look for a product that is certified organic, that specifies Nigella sativa as the botanical source, and that has been third-party tested for TQ content. Timaquinone content in quality black seed oils should typically range from 1 to 3%. Anything that does not disclose TQ content on the label or through a certificate of analysis is a product I would be cautious about. The application protocol that has been used in the most promising clinical studies involves warming a small amount, roughly half a teaspoon of the oil between your palms, and applying it in gentle circular motions to the target areas. For pain and inflammation joints, the lower back, the knees, apply directly to the affected area. For systemic skin health and the stem cell activation effects, the chest, the inner forearms, and the neck are areas with high transdermal absorption. For joint pain in the hands, which is extraordinarily common in seniors, massage the oil directly into the knuckles and the webbing between the fingers. Allow the oil to absorb for at least 10 minutes before covering with clothing. Do this every night consistently for a minimum of 8 weeks before evaluating results. Biological change takes time, and anyone who tells you otherwise is selling something. One more thing I want to address before we wrap up, and that is safety. Black seed oil has an exceptional safety profile. It has been used medically for over 2,000 years across multiple cultures, and modern toxicology studies confirm that it is well tolerated in both topical and oral applications. However, as with any bioactive substance, there are considerations. If you are on blood-thinning medication such as warfarin, speak with your physician before adding black seed oil, as TQ has mild anticoagulant properties. If you have a known allergy to plants in the Ranunculaceae family, do a small patch test before broader application. And if you are currently undergoing chemotherapy, please discuss this with your oncologist before using it. Not because of any known harm, but because of the importance of not introducing variables during active cancer treatment. There is a reason this information does not get the attention it deserves in mainstream medicine. It is not because the science is weak. I have walked you through the actual studies today. It is because naturally occurring plant compounds cannot be patented. Without a patent, there is no multi-billion-dollar incentive to fund the large-scale clinical trials that would bring this into mainstream medical guidelines. That is not a conspiracy theory. That is an economic reality of modern pharmaceutical development. And it means that the responsibility falls on physicians like me to read the independent literature and bring this information directly to the people who need it. For seniors dealing with chronic pain, slow healing, skin deterioration, immune vulnerability, and the very real fear of cancer. This is not just a wellness tip. It is a scientifically grounded intervention that costs almost nothing, carries minimal risk, and has a body of evidence behind it that grows more compelling every single year. You deserve to know about it. I hope this video has given you something genuinely useful, not just interesting, but actionable. If you found this helpful, please do me a favor and hit that like button right now. It sounds like a small thing, but it tells YouTube's algorithm that this information is valuable, which means it gets shown to more seniors who need to hear it. If you are not yet subscribed to this channel, subscribe and turn on the notification bell so you never miss an episode. Every week, we bring you the kind of evidence-based health information that your doctor may not have time to explain in a 15-minute office visit. And in the next video, and I really think you are going to want to watch this one, we are going to talk about a specific combination of two natural compounds that, when taken together at a precise ratio, have been shown in clinical studies to reduce arterial stiffness in seniors by up to 30% in 90 days. Arterial stiffness is one of the primary drivers of heart attack and stroke risk. And almost nobody is talking about this research. It is coming very soon. So make sure you are subscribed so you catch it the moment it goes live. This is Dr. William Lee. Thank you for trusting me with your health, and I will see you in the next. Thank you.